This is just an emotional moment for me. The head of the Division Reproductive and Maternal Health, Kenya, Dr. Edward Serem, Director General, National Council for Population and Development, Dr. Sheikh Mohammed, keynote speaker, Ms. Lori Adelman, our youth representatives, Lauren Elegwa, Felicity Noma, all esteemed speakers, government representatives from across the region, esteemed delegates, the Reproductive Health Network board members and the Reproductive Health Network members, distinguished guests, all protocols observed, good afternoon. Good afternoon. It is an honor to welcome you all to the 7th Adolescent and Youth Sexual and Reproductive Health and Rights Scientific Conference, convened by the Reproductive Health Network Kenya in partnership with the Ministry of Health Kenya, and co-convened also by the Center for Reproductive Rights and HIVO's SRHR Fund. Today, we gather with a shared vision of a future where every young person across our continent can enjoy the full spectrum of their sexual and reproductive health and rights, empowered to make informed decisions about their lives and bodies. I know we struggle with the issue of consent, we struggle with the issue of making choices, and we think about what our countries allow when it comes to the issues around consent. I'm glad that some of the conversations will be around that, and we'll be looking at context, we'll be looking at privileges, we'll be looking at why do we have to not allow young people to access services and information and peg it on consent. And we think about that girl from Uganda, the rural area of Uganda, who is 13 years, is married, lives with a sick grandmother, and she has to engage in transactional sex for her to earn a living for the family. And when she goes to a healthcare provider, the healthcare provider says, no, I'm not able to provide services because you need consent. And the sex she had was from, we call them boda boda, the motorcyclists. And just thinking of maybe at that time she was having sex, it was unprotected, and she was, transactional sex where she hoped she could get something to put food on the table because the grandmother is sick, bedridden, and is not able to go out and, earn something for them. So when we think about those compounding vulnerabilities and all those issues, where are we placing the lives of our adolescent and youths in our continent? Who do we expect to consent for them? Governments, policymakers in this room, how do we work around that to ensure that we are not denying them information and we are not denying them services? And these are the realities we encounter in the communities. I'm also reminded of Kajiado, where we have a young person who got married at 15. And by the time she was getting married, she had to undergo the female genital cutting because that's the rite of passage, and into adulthood, she has to undergo the cutting and become a young mother. And she has no choice because it's the husband that then has to, who is an older man, that has to determine when actually they should have sex, so she has no power when it comes to sex pleasure. When she, in terms of the number of children, she's supposed to give birth to children on maybe an annual basis, so she even does not have an opportunity to grow as a young girl. Like he correctly put it, a young girl already pregnant, no consent, you have to quickly develop and become a woman and take care of a child. And those are the stories we face every day in our communities. I'm also reminded of the several commitments we've made as countries. And I'm so excited that today in this room, and just to giving it up to the government of Kenya that we work very closely with under NCPD, they've been at the forefront of ensuring that we are advocating for some of these commitments and ensuring that they are implemented. But we still have gaps. When you go to some of the communities that we work in, you will find that, some of the beneficiaries were the adolescent girls and young women do not even know these commitments were made on their behalf, and they continue to face the social-cultural norms that deny them access to information and services. So really moving from talking to action, what are we committing in this meeting? What are we saying we are going to do as actors in the region, because we cannot negotiate and continue having stories about the lives of adolescent girls and young women. If we had not been given opportunities, if someone had not stood up for us, we would not be here today. We can't repeat talking about commitments that were made. We need to be showcasing what we have done. Where have we moved to? Who do we need to hold accountable? And I am proud that as a local organization, a non-governmental organization, we are convening this meeting, and just to change the narrative that, it only takes probably an INGO to convene, or it takes ICFP or Women Deliver for us to convene and have this important conversation. It is possible for us to have these conversations in our land, and it's possible for us to bring those conversations right at the table where the decision makers are, and bring the young people close to the decision makers, policy makers, investors, and hold them accountable in terms of how long do we continue to become adolescents that are pregnant? How long do we continue to not go back to school, or where we are needed to go back to school, you're referred to as a woman at the age of 13? You have policies that are only on paper. The reality on the ground is they are not able to go back to school because someone will refer to them as a woman. Someone will refer to them as a badly behaved girl who got pregnant at an early age instead of being in school. But what are the causes of them being pregnant at 12, 13 years? Is the information available for them? Is this information all available? We talk about age-appropriate information. Is it available for them? So really, I decided that I will not want to talk about commitments and the data. We know that. As we start off this convening today, is for me to challenge all of us to move from speaking to actions, to moving, doing your part at whatever level, grassroots, community. And I'm happy that a lot of delegates are the people that are implementing and doing fantastic work around adolescent and youth. But we need to do more. We need to push. We need to act. We need to call out if we have to call out, because we need our girls in school. We do not need them in homes as wives. We do not need them at home taking care of cattle and babies behind their back, another one breastfeeding and cooking. We need our girls back to school. We need our girls empowered, well-skilled, so that they can be able to take care of the society. We need a lot of leaders that we are seeing here today. And that can only happen when we collectively stand up together, when we collectively move from showcasing the work and pushing beyond. Thank you so much. I hope you enjoy Mombasa. I hope you enjoy Kenya. It's a beautiful country. Please feel free to, make sure you move around and see the amazing work that is being done by the partners. We have a youth cafe that is a very beautiful space. When we thought about the adolescent girls and young women in this room, we thought about a space where they can just sit and reflect and not get into, boring conversations from morning till evening, but have a space where they can have conversations amongst themselves. At the end of the day, they will be holding us accountable and asking us, RHNK, so what? You brought us here for 4 days, so what? We want for sure to be able to answer the so what. Thank you so much.